There are disturbing reports that show a correlation between the coronavirus and strokes in young people. WBZ is the only local TV station with a doctor on staff, and Dr. Mallika Marshall joins us now. Doctor, you know I was terrified of this. This was such a frightening report to read over the weekend.
That's right. It's got a lot of people's attention. You know, these were doctors at Mount Sinai in New York who described 5 people under the age of 50 with really little to no symptoms of COVID-19 who suffered severe strokes and then tested positive for the virus. Now, there are other hospitals that have reported similar cases. The number is low, so I don't want people to think that there are lots of young people out there having strokes from coronavirus, but it sort of adds to the growing evidence that this virus, for whatever reason, is able to trigger the development of blood clots in the lungs. We've been seeing that, and now clearly in the brain as well. So I just want to remind people that if you develop symptoms of a stroke, facial droop, slurring your speech, inability to use your arm or your leg, please call 911. Don't hesitate.
So important. Doctor, the CDC has added 6 new symptoms to the list of what to watch for with COVID-19. What are they?
So we sort of talk about this triad of fever, trouble breathing, and cough, but they've added these 6 other symptoms, which we've been seeing for some time now, but now it's official. So those are chills, repeated shaking chills, muscle pain, headache, sore throat, and new loss of taste or smell. If you develop any of these symptoms, they can develop sort of 2 to 14 days after exposure to the virus. And if you do have them, you definitely want to isolate yourself. Try to isolate yourself from anyone else in the household as well, and call your doctor to find out if you should or can get tested.
Doctor, we also have some viewer questions this evening to ask. Brooks writes in an email, when should you throw away a disposable mask and change to a new disposable mask?
Okay, so remember that disposable masks and those N95 masks are still in short supply for a lot of healthcare workers and first responders, so let's reserve them for them. The general public is encouraged to wear cloth masks, which you can wash and you can reuse. If for some reason you do have disposable masks, you really should throw them away after they get soiled or if they get wet, and you shouldn't use them for more than a day.
Penelope has a question as well. She writes, I have been wondering if hanging my masks after use in the garage for 3 days or so instead of washing them would be okay. Would the virus die off in this situation?
It is a good question, and we're not exactly sure how long the virus lasts on cloth. There was a study that suggested that at least on surgical masks, the virus can last up to 7 days. So I would say, to be on the safe side, wash them in the washing machine with some detergent.
Just err on that side of caution.
That's
All right,
right.
Doctor, thank you. We appreciate it.
Thanks, Lisa.
Lisa, doctor, thank you.